You may have heard of a plant-based diet, but what does that really mean? Is it the same as being vegan? Is it different? What are the health implications of a plant-based diet? Well, if you're interested in this topic and using food as medicine, you'll definitely want to tune into this week's episode of the IQ podcast with my very, very special guest, actually a celebrity guest and VIP, Ocean Robbins. So stay tuned. Welcome, 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 everyone. Welcome back to another episode of the IQ podcast, where you can gain insights into your vision health and brain health and raise your IQ. I'm your host, Dr. Rani Banik, and today I am so excited to welcome our special guest who is I think he's like a celebrity in my mind. He's so well known, and he's just a wealth of information, and he's a real leader in his field. So I wanted to welcome to the IQ podcast Ocean Robbins. So Ocean is co-founder and CEO of the million-member Food Revolution Network. He's the author of the bestsellers 31 Day Food Revolution and Real Superfoods. Ocean founded Youth for Environmental Sanity, also known as YES, at the age of 16. Yes, 16. And he directed it for the next 20 years. He's spoken in person to more than 250,000 people. He's organized online seminars and events, reaching more than 1 million people. And he's facilitated leadership development events for leaders from 65 nations. He served as an adjunct professor for Chapman University and is the recipient of the National Jefferson Award for Outstanding Public Service, the Freedom's Flame Award, the Harman Wilkinson Award, and many other accolades. His TEDx talk, Eating Our Way to Happiness, has been seen by more than 1 million people. So again, I am so honored that you are joining us today, Ocean. Thank you and welcome.
Thank you, Dr. Rani. It is so great to be with you.
Yes, absolutely. So just for some background, Ocean and I met at a conference. I believe it was about 2 years ago, a plant-based nutrition healthcare conference. And I was so excited to meet him. I'd heard about him for years, but I'd never met him in person. And since then, Ocean's interviewed me several times for some of his work. And it is so nice to bring it full circle. And now I'm getting a chance to interview you as well. So, so I always love to start out by asking my guests, please share with us your background story, because you have such a fascinating story, and I always love to hear you share it. So,
well, I grew up in a family that was fairly obsessed with food. I was born in a one-room log cabin in the middle of the woods to parents who were practicing yoga and meditation for several hours a day, growing most of their own food, and naming their kid Ocean. You could say they were hippies in a sense, back to the lander types. And in my family growing up, it was all whole foods. It was all plant-based. And, if I was good, I could have a teaspoon of blackstrap molasses on my oatmeal. That was the only sweetener I had in the first 4 years of life. But I didn't feel deprived because I had love, I had time with my family, I had beautiful nature around me, and I had health. And I grew up in a family where health was prioritized. Now, this was kind of a pendulum swing, however, for my parents. My dad had grown up in Southern California in the Baskin-Robbins family. My grandpa Irv Robbins founded the Baskin-Robbins ice cream empire. My dad, John, was groomed to one day join in running the family business. He grew up with an ice cream cone-shaped swimming pool in the backyard. And yet, when he was in his early 20s, he was offered that chance to join in running the company. And he said no. And he walked away from a path which was practically paved with gold and with ice cream to, as we jokingly put it in our family, follow his own rocky road. And he ended up moving with my mom to a little island off the coast of Canada where they built that cabin where I was born. So it was quite a pivot. My grandpa Irv was really mad when my dad walked away from his life's work and went off to become a back to the lander hippie. And they didn't speak for years. And you could understand why. He'd built this business he was proud of. He wanted to share it with his only son, and my dad had walked away. Mm-hmm. But in time, remarkably, we found that blood is thicker than ice cream. And sometimes love is more powerful than even bitter resentments. Because what happened was that when my dad's book, A Diet for a New America, came out in 1987, which is about how our food choices impact our health, happiness, and the future of life on earth, it became a runaway bestseller. reached millions of people. And one of his readers ended up being my grandpa Irv. My grandpa was on death's door. He had serious diabetes, weight issues, heart disease. His doctors told him he didn't have long to live unless he made big changes.
Mhm.
They told him to read a book, and they gave him Diet for New America. Well, my grandpa read it. He followed its advice. He ended up reversing diabetes, reversing cardiovascular disease, losing a bunch of weight. His golf game improved 7 strokes, and he lived 19 more healthy years. So, we really have seen that sometimes you can make big changes and get big results in our family personally, and also my dad's work has inspired millions of people to look at food as a chance to make a difference for their health and their world and reap the benefits. So I've gotten to grew up in these stories, saturated with these stories, and then I launched Food Revolution Network in 2012 to work with my dad directly and help bring this movement to the masses.
Wow, what an inspirational story. And your father obviously was a pioneer in this field, breaking away from family tradition, which took a huge amount of courage. And he's passed that along to you. And now you're a pioneer in your own right in so many different aspects of what you do in your work. I know that one of your big, kind of stakes in the ground is eating healthy, and you're a big advocate of a plant-based diet. Now, many people probably have heard of it, but they may not exactly know what it means. Could you just share with us a little bit, what exactly is a plant-based diet? And is it different than a vegan diet, or are there different types of plant-based diets? Could you just share with the audience some of your expertise on that?
Sure. Well, plant-based diet means you're basing your diet on plants, right? And that can mean a lot of different things to different people. Some people think of plant-based as being that it originated from plant material, but it still could be
Hmm.
a product of a factory. A lot of people now use the term whole foods plant-based to make a
Hmm.
distinction that they're not talking about ultra-processed plant-based foods like French fries. They're talking about wholesome foods that Mother Nature would recognize.
Hmm.
And and what we're learning is that from a health perspective, we need both. We need the whole foods and we need the plants to optimize our well-being. And there's more research coming out all the time showing that ultra processed foods are killing us in droves. But we're also seeing that an animal product centric diet is also killing us in very large numbers. The research is fairly overwhelming that diet related disease is the leading preventable cause of death
Hmm.
on the planet today. According to the United Nations last year, 41 million people died prematurely last year from preventable lifestyle related illnesses. Now, lifestyle medicine has 4 pillars. Essentially, it's eat better, stress less, love more, and move more. They're all super
Hmm.
important. I focus on the eat better part, which I think is the number one most powerful point. And
I
you
agree
know,
completely. Yes.
and vegan means strictly, technically consuming no animal products. Technically, that would even include honey, and a vegan lifestyle would also mean no leather shoes and trying to
Hmm.
not use animal products in any way, shape, or form. Technically, a lot of people use the term much more broadly and loosely. Plant-based is a little more broad, and some people then use the term exclusively plant-based to mean they only
Hmm.
eat plant-based foods, or exclusively whole foods plant-based. There's lots of language. At the end of the day, whatever box or category or label you put on yourself, I don't think is as important as actually what you eat and how you live, and creating a way of thinking about it that helps you to know what you stand for and what your values are. What
Hmm.
I find is that, moving away from ultra processed foods and animal products and moving towards whole plant foods, whether you go all the way or part of the way or most of the way, every step counts, and that movement can create profound life-giving benefits. The basic reality is most of us need to eat more fiber, and that's what nourishes the microbiome we're all hearing so much about. The good bacteria in your gut depend on fiber to survive, and the average American's getting less than half the amount of fiber they need. Less
Hmm.
than 4% of us are getting the recommended amount of fiber. There's no fiber in any animal products or in bottled oils or in added sugars. It's only found in whole plant foods. It's found in all whole plant foods. So fiber is a really critical piece of the puzzle here. And then we also need those phytonutrients, the antioxidants, the flavonoids, the polyphenols that are found predominantly in the plant kingdom. And
Hmm.
those give us the ability to fight cancer, to improve our eyesight, to improve our brain
Hmm.
health. to help bring down chronic inflammation in the body. And so what we're seeing is that with healthy diet and lifestyle, we could prevent about 80 to 90% of heart disease. We can prevent 30 to 50% of cancers. We can prevent 50 to even up to 80% of Alzheimer's disease. And these are huge numbers with vast implications. And a lot of this comes down to eating more whole plant foods.
Yeah. That was beautiful, Ocean. Such a wonderful summary. I wanted to highlight two things that you mentioned. Number one, we ideally all of us should stay away from ultra processed foods and move more towards plants, but some people do eat a lot of ultra processed foods that are plants, so that may not be the most healthy. So if you are kind of switching it out, that's great that you're switching out some of the animal products, but also be mindful of where it's coming from, how it's made, how it's processed, etc. The second thing I wanted to point out is you were saying how, you know, a plant-based diet, especially a whole foods plant-based diet, could be so critical to prevention of disease when it comes to eye conditions, which a lot of our listeners are interested in. Unfortunately, there aren't those huge studies to back everything up, but we know that all those amazing nutrients you talked about, the antioxidants, the polyphenols, the bioflavonoids, especially the macular carotenoids, are critical to preventing so many visual issues, macular degeneration, perhaps even glaucoma, cataracts. So even though the data is not there yet, I just wanted to point this out. We should always strive to eat more plants, even for our eye health, especially for our eye
Yeah.
health. So thank you for
And
bringing
just
that up.
just to anchor a couple of general principles in there, what's good for cardiovascular health, increasing circulation throughout your body is going to be good for every part of your body, and your eyes need blood flow to function well. And when that's flowing properly, that's going to be healthy. And another sort of universal principle for body health is inflammation. When you
Absolutely.
bring down chronic inflammation in the body, you create the conditions for your body to thrive. Now, obviously, inflammation is critical to fight disease or illness, but a lot of us are living in a state of chronic inflammation, and that shows up in the eyes like irritation or other conditions that can make it harder for your body to actually fight real problems when they show up. And so you want to dial down chronic inflammation and increase blood circulation. And both of those are principles that affect the brain, they affect the heart, they affect your eyes and every other function in
Mhm.
your body. So that's some things we know for sure. And yes, of course, there's a lot more to learn study wise about specifics of specific nutrients in foods and so forth for eye health. But we know a lot about, as you do, and you speak so eloquently about, Dr. Rani, about all of the polyphenols and all of the incredible compounds of vitamin A's and all the other things that we get from vegetables,
Mhm.
that are so important, and fruits that are particularly critical, for eye health. And I just find that so fascinating because we all want to see clearly. And, I'll
Yes,
say for
absolutely.
myself, my parents both grew up like incredibly nearsighted and farsighted, and they had every which issue with their eyes. And I've been like 20/20 vision my whole life. And I don't know. I'm an N
Yay.
of one here, right? I don't know if
Yeah.
that's because like I grew up eating super healthy food or whatever, but I'm sure it didn't hurt. Let's just put it that way.
As you mentioned earlier, it's lifestyle medicine. It's not only diet. Diet is, yes, the foundation, but then there's also movement and love and connection
Yeah.
and all of that. So, and reduction of stress. I wanted to just, you were saying earlier about inflammation. When it comes to many eye conditions, again, I'm going to repeat myself, but whether it be macular degeneration, glaucoma, cataracts, dry eye, the root cause of all of those is inflammation. And one of the best ways to fight that is through antioxidants. And our antioxidants, the best source is our diet. So just goes full circle there.
Yeah.
I wanted to next talk to you about something that oftentimes I get asked. When I try to steer my patients towards eating more plants, they always ask me, like, what about protein? If I eat mainly plants, am I going to be getting enough protein? There's always that question that pops up. So, what are your thoughts about that? About protein coming from plants? Is that complete? Is it a complete source?
Yeah. So first of all, protein is a bunch of different amino acids. Some of them considered essential amino acids, meaning you can only get them from food. And then there's others that your body can make on its own. You need those essential amino acids. All whole plant foods contain all of the essential amino acids, period. They're in all of them. Now they're in
Yes,
different
thank you.
ratios
Thank you
and
for
different
that.
amounts.
Yeah.
Same is true for animal products. Animal
Mhm.
products are more like the human body in terms of the ratio, because guess what? They're, especially if you're eating a mammal, well, its tissues have synthesized what it needs, which is more
Mhm.
similar to ours. Plants are more varied. But as long as you're eating a variety of different plant foods, you're going to get the mixtures that you need. So there's no need to like separate out specific amino acids unless you have a specific medical condition where there's a unique issue that's specific to you. But in general, for
Mhm.
most human bodies, you don't need to focus on the specifics. Just eat a variety of foods and get enough total protein. Now, what about
Mhm.
enough total protein? So what's the key data here? So you know, the World Health Organization and other major nutritional bodies generally focus on the minimum amount in order to be healthy or function. And
Mhm.
those numbers are fairly low. In fact, it's easy. If you're eating enough calories and you're eating whole foods, whether plant based or not, you will get enough by those metrics. The challenge is if you base your diet around ultra processed foods and you have a lot of added sugars, which have no protein, or bottled oils, which have no protein, and then you
Mhm.
are also vegan on top of that, which tends to be a bit lower in protein than animal products, then you could have deficiencies. Or if you're not eating enough total calories, and some people, especially
Mhm.
when they get older, their caloric consumption goes down, their activity level goes down, and then they also could have issues. So you want to eat enough total calories and whole foods. Those are the key baseline factors. If you're wanting to lean into more protein consumption, there's lots of plant foods to focus on.
Mhm.
Top of the list is going to be soy products like tofu and tempeh and edamame. All the legumes are fantastic.
Mhm.
If you're getting enough of those in your diet, you're almost certain to have enough overall. Um, and then very rarely somebody will add a little protein supplement or something. It's usually
Mhm.
not considered necessary. Hemp seeds are a great source of protein. Peanut butter is a great source of protein. There's
Mhm.
lots of options. But there's protein in all whole plant foods. Actually, vegetables are quite high in protein as a percentage
Mhm.
of calories. There's just so much water that you can't really use them as a staple from a caloric standpoint, but you're certainly getting plenty. So the bottom line is enough total calories and whole foods. And in terms of if you're an athlete or a performance athlete in particular, or if you're elderly, or if you're a nursing or pregnant female, then those are things that could cause you to need a little extra. And in
Mhm.
that case, again, just leaning into the whole plant foods and the soy and legumes is probably going to be just fine. But if you're in a specialized situation, then talk to a nutritionist or a dietitian or do a little analysis yourself just to be sure. The bottom line is that nobody has any need for animal products to get enough protein.
Mhm.
And the other thing to keep in mind is that most of us are actually getting too much. According to research from Dr. Walter Longo at University of Southern California
Mhm.
a few years back, they ended up concluding that more people are dying from excess protein than insufficient protein by a wide margin. The average American
Mhm.
is getting about twice as much as they need, and a high protein diet was found in their research to be more correlated with premature death than smoking 2 packs of cigarettes a day.
Wow,
So,
wow.
and
So when
specifically
you like,
cancer.
if I could just ask a quick question. When you,
Yeah,
in Dr. Longo's research, what is considered too much protein? Because I know, the as you mentioned, the US RDA recommendations are quite low. They're
right.
the minimal, but nowadays people are recommending 30 grams of protein with each meal. Is that considered too much?
It
Or, I mean,
it
does it
is.
depend on your kidney function, your age, other variables as well, I'm sure play into that.
Yeah, I mean, it's there's no one perfect formula for what everybody should be getting, but in Dr. Longo's research, they were looking at I think it was percentage of calories from protein, maybe more than grams per day. Um,
Mhm.
you know, the bottom line is that you want to avoid, and particularly animal protein, and this is a
Mhm.
fascinating subset of the research that's coming out now, is that it seems that when people get more protein from plants, it actually increases longevity. um, but when they
Mhm.
get more protein from animal products, it decreases it.
Decreases
Now,
it.
is that because of the company it keeps? Is that because of the saturated fat that's also with the animal products, or some other element, or the fact that it's leading to more TMAO production in the human body? We don't know for sure. But what we do see is that there's a direct link, and excessive animal protein is correlated with cancer risk. So,
Mhm.
as far as how much protein, I mean, most of us, I mean, I've done the calculus myself. I should probably be getting about 90 to 100 grams of protein per day. I'm a 152-pound fit male who exercises a bunch.
Mhm.
That's me. That's my own assessment. But everyone has their own journey and
Mhm.
discovery. That's more than you might say is the minimum that the World Health Organization is going to recommend. But it's what seems to me to be optimal for my performance. But getting that from plants is easy. 30 grams per meal. Well, you don't have to get all meals the same. I mean,
Mhm.
I started this morning. I had a little shake where I had unsweetened soy milk from Eden Soy. There's 12 grams of protein per cup. So I had 2 cups of that in there. That's 24 grams right there. I added some hemp
Mhm.
seeds and
Yeah.
some peanut butter and,
Yep.
and
And
some
it
frozen
adds up
bananas and a little
nicely.
frozen
Yeah.
fruit and some berries. And I was having like a solid 35, 40 grams of protein right
Mhm.
there. Not
Yeah.
hard then on top of that, just to get some
Yeah.
basic, wholesome, healthy food the rest of the day. And I'm at 100 grams. So these aren't really that tricky, but it is worth paying a bit of attention to, especially if you aren't eating a lot of calories and if you're vegan.
Mhm. Mhm. Yeah. Well, thank you for that because I think a lot of people have this misconception about protein coming from plants. So thanks for clarifying. And you're the perfect example. You're easily getting all this without even having to try hard. Welcome back, everyone. We are chatting with Ocean Robbins, who is such an expert in so many different areas. He's just a wealth of knowledge. But Ocean, I wanted to just ask you next about this movement that you've co-founded with your father, the Food Revolution Network. Tell us about this organization and what you stand for, what your mission is, and how you've helped people.
Food Revolution Network's mission is healthy, ethical, sustainable food for all. And, you know, let me break that down for a second. When we talk about healthy, we're essentially promoting whole plant foods. We want to help stem the tide of the chronic disease epidemic. We realize that we can save millions of lives and trillions of dollars globally simply by changing the food on humanity's plates. Ethical means we're looking at the social and humanitarian aspects of food. How are animals treated when they're raised, especially in modern factory farms? How can we create a food system that is kinder and more respectful of farm workers, of everybody in the system itself, and of the animals involved? And sustainable means we're looking at the impact of food on the planet that we share. Worldwide, right now, 83% of all agricultural land is animal agriculture to produce 18% of the world's calories. It's kind of like a protein factory in reverse. When you cycle calories up the food chain, you get inefficiencies. And so we're trying to raise awareness of this and what could be done if we were to turn some of that 83% of farmland back into forest, into
Mhm.
rewilded ecosystems, to sequester carbon out of the atmosphere. 80% of tropical rainforest destruction has been directly linked to livestock production. What could happen if we were to turn that around and reforest and rewild because we ate lower on the food chain? And so these pieces are all connected. And from my standpoint, one of the most powerful things any of us can do if we want to contribute to healthier lives and a more ethical world and a more sustainable future for our kids is to eat lower on the food chain and to eat more
Mhm.
plant foods.
Mhm. That's beautiful, absolutely beautiful. So, as part of this, the organization you founded, so do you have different facets? For example, education, policy. What exactly? I mean, how is it broken up, and how can people learn more, get involved in Food Revolution Network, and support
Yeah,
your cause?
if you go to foodrevolution.org, you can check out our work, and we have hundreds of articles on leading edge food and health topics. We have hundreds of recipes. We have a wealth of different master classes and paid courses and online summits and films and books. Our latest book, by the way, which just came out, Powered by Plants,
Yay!
nutrient loaded protein for
Congratulations.
yield to help you thrive. Thank you. Yeah, I think this book is just like one of the most beautiful books I've ever seen. And I'm so excited about it. And what this book does is we go over nutrients And the top nutrients that can be hard to get, even on a whole
Mhm.
food plant-based diet. And we look at where they're found, what the real story is on them, and how to get enough. And then and we focus on and then where supplementation might be advisable in a few cases, you know, but we're really
Mhm.
giving people the real scoop. And then we have recipes that are loaded with those nutrients. So you're getting plenty of, you know, the calcium and the magnesium and the B12 and the protein and the fiber and,
Mhm.
you know, all the vitamin K2 and all the different nutrients that you need if you really want to optimize your health.
Beautiful. Well, congratulations. And I'm so looking forward to reading that book, Everyone Powered by Plants, coming out in October. So also probably makes a great holiday gift. So, not get a copy for yourself, consider getting a copy for all your loved ones. Help them to change their lives and empower themselves with the power of plants. It's so, so important. I want to just ask you, we're nearing the end of our chat, but I wanted to ask you about some of your efforts and at the governmental level to institute change. I know we don't have much
Yeah.
time, but just if you can just share with us, what are some of the projects you've been working on? Because I know you've shared them with me. They're fascinating, and
Yes.
I just applaud you for your work with that.
Thank you. Yeah, I mean, we define ourselves as being an organization focused on education and advocacy. So we want to spread the truth, science-backed, research-backed, credible information. We also want to advocate. We've got an agenda. We want healthy, ethical, sustainable food for all. And so part of how we promote that is by looking at policy change and how we can create the conditions where it's easier and more accessible to enjoy delicious, healthy, nourishing food. And right now, we kind of have things stacked in the wrong direction. Every year in the United States, US taxpayers provide tens of billions of dollars in subsidies that are essentially driving down the price of what we call commodities crops. Now, in effect, we're driving down the price of high fructose corn syrup, of white bread, of sugar, and of many of the ultra processed foods we're consuming today. And in effect, we're creating a marketplace distortion where it becomes more expensive in comparison to eat broccoli, to eat wholesome, healthy foods than it is to eat junk foods. And
Hmm.
so what this does is it creates a economic disincentive that impacts poor people the most. Because if you're struggling to survive, then you want the cheapest calories that will keep your belly fed and your kids' bellies fed so you can go on another day. And if those calories also happen to be ultra tasty and ultra addictive, you get hooked for financial reasons and because these industries are preying on the addictive cycle. Now, this is something we've all got to break free from if we want our health back, if we want our lives back. And it's also something that is critical to our ability to create a healthy society, a just society for future generations. Health disparities along race lines in the United States are estimated to cost minorities, people of color, $450 billion per year compared to if
Hmm.
they have the same health outcomes as white folks. The primary
Hmm.
drivers of those health disparities include stress and economic and environmental factors, but they also include dietary and nutritional factors. And a lot of that comes back to subsidies and to government policies that, in effect, are condemning the poor to nutritional disasters. So we want to
Hmm.
help shift that. And some of the leverage points, of course, the Farm Bill, which is where a lot of this funding gets doled out, is one critical leverage point. But produce prescriptions is another. We want to see doctors able
Hmm.
to prescribe fruits and vegetables to their patients for lifestyle related illnesses and be able to have the prescription covered by insurance. We also
Hmm.
want to see double up bucks, which is where SNAP dollars, food stamp dollars, have double value when used to purchase fruits and vegetables. So
Hmm.
those are a few of the campaigns that we're focusing on. We also want to focus on awareness and bringing this all together so people realize that every bite you take, you're actually investing in an industry. Do you want to invest in companies that are perpetuating government policies that are in their own financial best interests and that are harming public health? Or do you want to
Hmm.
invest in local farmers, in small scale natural producers that are doing things the right way, that have something called ethics, that have something called integrity, and that are looking out for the common good? When we help build a new economy based on healthy lives and a healthy future, then we actually create a whole new system. And that's what I'm so excited about. And I look at every dollar I spend on food as a vote. And I want to vote
Mm-hmm.
for the health I want, but also for the economy and the society and the world that I want.
Mm-hmm. Wow, amazing. You are truly a pioneer in this, and affecting change is not easy, I'm sure. I'm sure you come across some big, powerful industry giants. So again, I really applaud you for your work. I remember we had this conversation, believe it was last year, where one of the other campaigns we're working on is education within healthcare for providers. Because I think that's one of the bigger missing pieces here is there's education on different levels, but if providers themselves are not aware of some of the research that's been done on what's driving all of this disease and et cetera, we can't properly educate our patients. So tell us a
Yeah.
little bit more about that particular campaign.
Well, in medical school, the average physician gets less than 19 hours worth of education on nutrition in all their years of medical school, and most of that
I
is
can tell
focused.
you, I just want to add something here. I thought back, I think I got 4 hours back,
Yeah,
when I was in
yeah, and
medical.
some
So
get 0.
19
There's no
is,
requirement.
that would be like a, yeah,
Yeah,
a
there's no
huge improvement.
requirement that there be
Yeah.
any. And what
Yeah.
there is usually just focused on the specific nutrient deficiencies and how to diagnose and treat them, not on how to
Yeah.
help patients eat well. And I think that a doctor not knowing about food is like a firefighter not knowing about water. I mean,
Hmm.
food is the foundation of health. It's the starting point for everything, and yet it's being completely ignored because the pharmaceutical interests are dominant in medical practice and education today. And I do believe, honestly, that if broccoli was reimbursed as much as chemotherapy drugs, we'd see more broccoli recommended by doctors. We'd see more broccoli eaten, and we'd see less people dying of cancer, to be perfectly honest. Um, so I do believe that there's a financial incentive here, but regardless of that, the status quo has got to change. And so we
Hmm.
we teamed up with the American College of Lifestyle Medicine a few years back, and we're looking at what's driving this. And the bottom line is that medical schools, teach to the test, and the tests are administered by the National Board of Medical Examiners.
Hmm.
And the NBME has, about 10,000 questions in the overall bank that they use for the medical schools, including about 1,000 that are used as required mandatory questions. None of the required mandatory questions, and very few of the 10,000, have anything to do with diet or
Hmm.
lifestyle medicine whatsoever. And so we started a campaign to try to address that. And ultimately, American Board of Lifestyle Medicine wound up creating a new set of 1,000 questions that could be added to the bank that medical schools could start to use. And they're now being used by those medical schools voluntarily that want to bring lifestyle medicine in, and as part of the board exams for lifestyle medicine practice as a specialization, which is gaining steam and becoming more and more recognized as a specialty. We are hoping that in time there can be sufficiently widespread adoption in medical schools that the NBME will make these part of the mandatory question bank. And that's when we start getting education change, because it'll have to if the students are going to pass the tests. So it's one step at a time. We're trying to
Hmm.
work on getting widespread adoption. ACLM is really leading the charge on this, but we helped kind of orchestrate the campaign and raise the funds to create those 1,000 questions for the bank, which I think is a critical piece of the puzzle. One
Yeah,
step at a time,
that's
and
a
we'll just
tremendous
keep
effort.
going.
That is not an easy task. And so I really look forward to that, when they do become part, or some of them become part of the core questions that are
Yes.
asked, because that will drive that. And I think also, I have to say, like the younger generation of medical students and young doctors, they do seem more health conscious than perhaps
Yes.
my generation was.
Yeah.
We were not taught, we didn't really think about it. But now I think the atmosphere has changed and patients are requesting it. So then the younger providers also are, they lead healthier lives. I think, we don't, most doctors don't smoke anymore. Back in the day, doctors used to smoke very
Yeah.
commonly. So, those types of changes are slowly coming through the pipeline. But well, it's been such a fascinating discussion with you, Ocean. Thank you for sharing everything that you're doing. And I hope that people will, reach out and perhaps join your network and be part of the movement. If there's one last message you would like to leave our listeners with, what would that be?
I would just say thank you for your curiosity, for your interest in learning about health and about how you can nurture your health from the ground up. Our dominant medical system focuses so much on treatment of disease. And of course, in the right situation, that's wonderful. There's the old saying, a person with their health has 1,000 dreams. A person without it has got one dream, which is to get it back. When you're suffering, when you're in pain, getting your health back is the only thing that matters sometimes. But those of us who have the opportunity to prevent illness can do something huge, because it's
Mhm.
always easier to prevent getting sick in the first place than it is to recover after something has gone wrong in the human body. So, sometimes pain pushes, sometimes vision pulls. If you're suffering, if you're hurting right now, you may be motivated by a desire, perhaps even a huge desire to feel better. If you're feeling pretty good right now, don't just rest on your laurels. Invest in your health and your life by optimizing. We live in a toxic food culture. It's so easy in a toxic food culture to lean into foods that make us sick. Not necessarily right now, but in the long run. So
Mhm.
pay it forward. Invest in your best future life. Your body will thank you forever.
Well, that was so beautifully said, Ocean. And I second that. I mean, everything you said, I'm completely in line with. And I hope that this discussion, listening to our discussion, will open people's minds to the power of plants. I encourage you all to get Ocean's new book. The links will be in the show notes. And again, yes, powered by plants, Ocean Robbins. So thank you again so much for being a guest on our podcast. And I would love to have you back at some point to talk more about the policy aspect, because I think it's so fascinating. There's so much we can really dive into, but we'll save that for next time.
All
Thank you.
right. Awesome. Thank you so much.
Thank you. It was a pleasure.